Hi, I'm Dr. Joe Nemeth. I'm a periodontist in Southfield, Michigan, and I want to talk about vaping today. Now, this is vaping. Actually, it's a form of getting nicotine into your body without smoking cigarettes and having the tar and the damaging substances from cigarettes get into your lungs. However, you're still getting nicotine from the vaping. And we're finding that the nicotine concentration in some of these vaping products, this is called the Juul. I guess it's the most popular one, and it's far from a Juul when it comes to your mouth and your health and your teeth. It's just the opposite of a Juul, shall we say. So they're finding that the nicotine in these vaping products is strong and actually injures and damages the cells in the mouth. It can contribute to mouth cancer, it can contribute to gum recession, it can contribute to gum disease, because what happens is nicotine actually causes a constriction of the blood vessels. Now, if you're getting a reduced blood supply to the tissues in your mouth, your gum tissue, for instance, that tissue is going to be more susceptible to recession, more susceptible to disease, just generally unhealthier. So although if I had to make a choice between smoking cigarettes and vaping, I think vaping would be safer overall, health-wise, but not for your mouth. So neither one is really good as far as your health is concerned. And when it comes to the mouth, vaping can be particularly bad because the amount of nicotine varies from product to product. And some of these have very high nicotine, and the ones that are flavored are even more damaging to your gums and your mouth, because the flavoring agents themselves have been found, along with the nicotine, to kill cells that line the mouth and cells that actually make up the gum tissue. So what they did was they took cells called epithelial cells, they put them in a special media, and they exposed them to the nicotine and flavoring for 1, 2, and 3 days. They found that the cells were damaged after 1 day. They were damaged even more after 2 days. And over half the cells were damaged after 3 days of being exposed to the nicotine and flavorings. With the control group that was not exposed, there was almost no damage. So be careful. Vaping is not good for your mouth. It's not good for your health generally. Maybe better than smoking cigarettes, but not good for your mouth or your gums or your oral health. Now, the other thing is that these are much more accessible. They're easier to use. They're less conspicuous than smoking, so people feel it's not as noticed and they can get away with it more easily. So unfortunately, again, it's on the rise, and it's particularly on the rise among teenagers. The number of seniors in high school, this is remarkable. The numbers of seniors in high school vaping in the last year has actually doubled. This is the greatest jump in use of a substance, an abusive substance, that has ever been shown for something to double in use within a year. And that's what's happening in high school seniors. Remember, if your mouth is healthy, your body will be healthier, and this does not contribute to a healthy mouth. So join our YouTube channel. Comments, questions are welcome. Have a wonderful day. Keep yourself healthy.
Restore your smile and your health with the help of Dr. Nemeth and his associates. Visit drnemeth.com to schedule your appointment today.